What do wait times in Canadian healthcare system look like? Sometimes they look like this. Prashant, a 44-year-old man in Edmonton, walks into the ER with severe chest pain. He waits nearly 8 hours. He collapses after finally being called in.
We have a waiting room full of sick, dying patients who we can't get in. This is a failure of the system and a healthcare system failure, and we did independent public investigation.
Stacey Ross, a 55-year-old woman in Winnipeg, goes to the ER twice. She waits about 11 hours. Her infection worsens into sepsis. She goes into cardiac arrest.
My mother's death should never have happened. She could have been saved.
We need an external investigation to understand what's happening in our ERs and to restore some accountability to the system.
Judy Burns, a 68-year-old patient from Winnipeg, shows up with bleeding and confusion. Symptoms are dismissed. The condition worsens, cardiac arrest follows, and she dies days later. Finlay, a 16-year-old patient in Oakville, Ontario, is triaged as urgent. He waits for 8 hours, sepsis develops, and then followed by a cardiac arrest. Robert Power, a 69-year-old man in Newfoundland and Labrador, arrives struggling to breathe. He waits for more than 10 hours. His heart stops in the waiting room. And in Manitoba alone, reports have already linked to multiple deaths directly to delayed healthcare. These are individual cases. Each one has its own clinical details, but the pattern is hard to ignore. Delays, overcrowding, and limited capacity. Sherry Ross lost her sister who died from cardiac arrest right after admission after waiting for 11 hours. She asks how many people have to die before there is change.
My mother was taken from me. She wanted to live. She did everything possible to live, and the Canada healthcare system killed her.
Something's got to change, like starting from the triage department where you walk in. Something's got to change.
But seriously, how many people need to die before there is real change? The report from public policy think tank secondstreet.org revealed that at least 23,746 patients died in Canada while waiting for surgeries or diagnostic procedures just between April 2024 and March 2025. A total number of reported waitlist deaths since 2018 has exceeded 100,000. And it's not unreasonable to assume that these findings are likely understated, considering the fact that the death due to delayed access can go unreported. So I ask you, how many people have to die before there is any change?